We're now joined by Olalekan Oshunkoya, a policy analyst and researcher at Citizen Commons International. He joins us via Zoom from Abuja. Thank you so much for your time, Ola. Now, as countries meet to examine progress on these Sustainable Development Goals, how would you say COVID-19 has impacted progress in Africa?
Thank you for having me. There is no doubt that the pandemic has a significant impact on the potential of the world to achieve the goals of the SDG. And as you can see, a big part of the world poverty is in Africa, and then the effect of the COVID pandemic means that more people, more families, more communities have been put further into poverty because they've lost their livelihood. They have not been able to keep their life together because of the effect of the pandemic. There have been companies closing down, institutions not being able to advance their commercial activities because of the pandemic. And I think the United Nations pushed out a report that suggested that over 168 people in Africa alone will be pushed further the line because of their to poverty, extreme poverty actually, because of the impact of the COVID pandemic in 2020 and moving beyond that. So I believe that the potential of the world to achieve these goals of the SDG has been largely and significantly been affected by the pandemic. And the effect of this is being seen every day now. As you can see, people are losing their job, people are losing their livelihoods, and then the effort to bring back the lost income, the lost livelihood because of the pandemic, and is very low. And then the rate at which countries are able to adapt to the changes of the effect of the pandemic is also so low. And you can imagine what that says, because before that, we already having countries in Africa that are really struggling to meet these goals already because of low development and then bad governance as well. So I think there is no doubt, and clearly, pandemic has increased the gap and is bringing more people into poverty, and then it's going to make it even much harder and much more difficult to achieve the SDG by 2013 as originally designed.
And having said that, Ola, as you mentioned, Africa was already off track to try and meet these goals in healthcare, education and food security. That 2030 deadline is fast approaching. Is there anything at all that can be done to help Africa achieve these goals and get back on track?
Yes, there's a lot of things that can be done. And then I think one of the very first thing I will say is that it's important to get Africa vaccinated, because the pandemic is still here, it's not gone yet. I mean, we dealt with the initial effort to actually deal with it, but now that we have vaccination, we have to increase the potential of the African population to receive this vaccine. At least that way we know that we are reducing the potential of any other waves or any other comeback of the pandemic in the continent. And then another good thing I know that a few effort has been put in place that making sure that there is increased number of vaccination being made available by other countries, and then what we just have to do a whole lot more in educating the communities to actually take these vaccines when they become available. To make sure that the vaccines are available is one thing, to actually make sure that the communities and the myths surrounding the vaccine are removed, and then people are encouraged and are actually taking the vaccine. The other thing that can be done in terms of the effect of poverty and reducing poverty, removing particularly when it comes to the SDG 1, 2, and 8, which is one of the most affected because of the pandemic, is to how do we use technology to actually increase the potential to create employment, to improve livelihood. And I think it means the government, there has to be increased partnership to actually increase the opportunity to use technology in education, in healthcare, to be able to allow countries to take the potential, because if there is anything that the pandemic had made clear to us, that nobody is safe until all of us are safe. So
Indeed.
until all of us are able so we use technology, the digitalization of Africa. How do we invest in infrastructure to make sure that children that are going to school are able to do so without actually, when they are not doing so at home? Can they use technology to be able to have increased access to education materials, in healthcare as well? How do we make this investment? And of course, more importantly, the economic and social conditions of countries. What kind of partnership is it within the countries? And I think one of the best example with the AFTA, for example, it needs to be used as an instrument of development to increase commercialization, to make manufacturing, to make industrialization easy in Africa so that we can have jobs and so that we can also have improved livelihood. And I think African leaders need to do a whole lot more to work with partnership with development partners, with other countries that within Africa and outside of Africa, to actually make sure that our contributions are there's a targeted effort to make sure that the infrastructure investment, the governance systems are put in place to make sure, and also to ensure that there is social protection. Because again, if you think about what happened with the pandemic, it shows that when there is no social protection for the people, when things go wrong, it goes bad. Indeed. So we have to also start to think about policies that can be enhanced to make sure there's social protection for people so that when things go wrong, you have some sort of support from government that is institutionalized, that you can access, that can help you keep your life going, keep your life going, and then of course in healthcare, so that you can also begin to have access to these essential services that will make it easier to respond to this kind of pandemic and also other effects that helps the achievement of the SDG possible in all these areas.
Thank you so much, Olalekan Oshunkoya, joining us via Zoom from Abuja.